HSG, also known as hysterosalpingogram, I hope I get it correct, hysterosalpingogram, is very, very important in the life of someone that is trying to conceive. So after making my last video, so many people are asking me, why did I do the HSG? What is HSG? And why is it important that one need to do HSG? Calm down, I will explain all in this video. I will tell you the reason why you need to do HSG as someone who is trying to conceive, okay? So the reason why, as a TTC mom, as someone that is trying to conceive, the reason why you need to do HSG is for the doctor or for your gyno or for someone that is in charge of that test to see your fallopian tube, because HSG will help them to see your fallopian tube very well, to know if your fallopian tube is blocked. And it will also help them to see your ovary. It will help them to see everything in your body as a woman, as someone that is trying to conceive. Maybe you have married, okay? You are married for 1 year, 2 years, 3 years, 4 years, and you have tried so many remedies, you have tried so many things, and nothing changed. You have done so many tests, treat so many infections, go to so many fertility tests, but nothing changed, and they now recommend that you do HSG. The reason why you're doing that HSG is for them to see if your fallopian tube is blocked, if something is distracting the sperm from fertilizing the egg. Because if your fallopian tube is blocked, or if something funny is happening in your uterus or ovary as a woman that is trying to conceive, that means nothing is going to happen except by the help of the Holy Spirit, because nothing is impossible for God to do. Yes, some people do have blockage of fallopian tube, but they still conceive. That is miracle, okay, because God can do everything. But the reason why you need to just do everything, in order for you to know that you have tried your best, is left for God to help you, is for you to know if something is wrong in your fallopian tube. Because when you go for that HSG test, the gyno, the radiography, the doctor, I don't know the department that are in charge of that HSG, the person that is going to carry on the HSG is going to open your body as a woman. Yes, he's going to open your body. So when he used one kind funny object that are using to open the body, when he opens your body, there's this fluid that he will put in your body, as if to say they are giving you injection in the body. They call it dye, but not that type of dye that are using to dye clothes. The reason why they're putting that fluid is that fluid will help them to watch how the thing is swimming inside the body, to know if it's swimming fast. It will help them to know, because with the help of that, if that thing is swimming fast, which means it's not blocked, yes, it will help them to know that it's not what blocked. But if something is obstructing it on the way, that means something is wrong somewhere. It's blocked, and they need to do something about that, okay? So that is why they do that test, in order for them to check if the fallopian tube is blocked or not. And that fluid is very, very important, because when they were doing my own, the man was like, he was using that, like he was using his syringe to bring the fluid, and I was like, is this man going to give me injection inside the body? But later he will remove the needle that is in the mouth and put another thing that they will use to push the fluid inside the body. So, and it's not even, you cannot just go anytime you want to do the test. They have specific period that are doing the test, because if you see your period, maybe, period cycle is different. Like, everybody have their own cycle days. Some people have 28 days of cycle, some people have 24, some people have 25, some people have 37. So it depends on the cycle, but they do it 11th 12th day of cycle, 11th 12th day of cycle, when they know that you have not entered your ovulation. Because if you finish ovulating and you and your partner meet, they don't know if you are pregnant. So immediately after ovulation, they're not going to carry out the test again, because they need to check if you are pregnant. It's true that you might be searching for a child, you might be looking for a child, but nothing is impossible for God. Maybe that time you might be planning to go and do the test, might be the time that it will enter. And if you go do the test after your ovulation, you might be pregnant, and they will just terminate what you have been looking for. So that is why they do it before ovulation. That is before a lady enter ovulation. If you enter your ovulation, maybe after some days after your ovulation, they are not going to carry on the test again. They will just wait for another cycle to finish. Then they will now tell you the day that you will come. The day that I want to do my own, I made mistake on my cycle. I gave them cycle days that is longer. They said that they're not going to do it. It was when I now opened my cycle calendar that I now noticed that I made mistake. Even when I was telling the doctor that I made mistakes, he was like, "Are you sure? Are you sure? You need to be sure." I said, "Okay, I'm sure." It's later that I realized, because later I was discussing with one of those that are working there. He said that the reason why they don't do it is because you might finish your ovulation, and maybe you and your partner meet. You might take in without knowing, and for you to come and just like that, they will start doing it. It might bring out the innocent baby. So that is why they normally do it before you enter ovulation. Okay, and someone that is pregnant cannot do that thing. Yes, if you're pregnant already, what are you doing it for? Because the main reason why they do that test, that HSG test, is for them to check what is the problem. Why are you not taking it? As someone that is trying to conceive, what is hindering you from taking it? So that is the main reason why they do that test. So if you're already pregnant, no need of you going to do the test. Yes, no need of you going to do the test. So the only people that can do the test are those that are trying to conceive. You need to do it in order for them to check if your fallopian tube is blocked. How they will check how your uterus, abi ovary, is doing. They will just check your body as a woman to know what is wrong, because that will enable them to see your body very well. You going for scan, all those scans might not solve it, except if you have a minor issue. Maybe scan can see if your egg is not doing well. Scan can help to see it, and they will just prescribe something for you to take that will boost the egg. But if you have tried so many things and nothing is happening, you have done scan, you have tried to boost your ovulation, you have done hormonal profile, so many things, and everything is okay, nothing is wrong in that aspect, they will now ask you to go for HSG test. That is where you are now going to see how your fallopian tube is doing. Because if the fallopian tube is blocked, my dear, nothing will happen except by the help of the Holy Spirit. You know, nothing is impossible for God. But if it's blocked, there's no how the men's semen will pass and enter to go and fertilize any egg, because that place is blocked. It's just like when they cover road. How can you pass? You cannot pass now. So if they will check if the road is blocked. If the road is blocked, they will now know how they are going to treat it. But if the road is not blocked, they will now do another, some of the pregnancy tests that they can carry on to check where the problem is coming from. That is why it's very, very important. If you have been TTCing for so many years, so many months, so many days, you need to go for HSG. If you know that you have tried so many things and it's not working out, you need to go for HSG so that they will check if your fallopian tube is blocked. Because half of the problem of fertility is this blockage of fallopian tube. But so many of us don't know. Just go and do hormonal profile, scan, infection, keep treating infection, and you will not get any good results. So, but some people, I have heard so many testimony about this HSG. So many people have testified that after the HSG, they just took in. Even the day I went to go and do my own, one woman was just telling me that she did IVF and the thing failed. And also her friend did IVF and her friend's own also failed. But her friend came to that place that we went to. After doing the HSG, they prescribed some medicine for her, some medication for her. She just took the medication. She's still on the process of taking the medication, and she took it. It's even someone that directed me to go there and try. I have done this HSG, but the doctor that did it for me just used me to do business. But that is okay. It's only God that will judge, not be me go judge. So the lady now say I should go to this place, that they're okay with what they're doing, but with what they did to me, hey, I know say these people sabi wetin they do. The thing that they did in my body is different from what that man did to me. When that man finished doing his own, he just bring out everything, and I just stood up. He was even prescribing pain medication for me. I was like, I'm not feeling anything. Even when I came back, I still don't feel anything. The next day, me and my oga will continue with our tatata. But this one, even up to now, I'm still feeling pain. That day that I came back, I was not able to cook. My husband was the one that cooked the food we ate. The next day is even the worst. That is when the pain now starts. Upon say they gave me pain relief, but my stomach everywhere was aching me. Like I was even feeling if malaria wants to do me, but it's pain from that. So it was after 2 days that I start, getting myself, some pain start reducing. If you go to my woman part, that place is no go area. Come to talk of somebody putting something to, like, are you okay? So I now know that there's difference between Egbe and Egbe. So that is it all about my experience with the HSG. And HSG is also very important for someone that is trying to conceive. So if you can try and do that, it's okay. The amount they charge me in this place that I want to do, they charge me 50,000 naira, 50,000 Nigeria currency for the HSG test. So I don't know how much they might be charging in your location. It depends on where you are, and it depends on the hospital. Some hospitals charge lesser, some charge higher. So they just collected half of 100,000 naira from me, but the money is not even the issue. I just pray that after this one, I will get a good result. Honestly, if I get a good result, if I conceive, I will not remember all those money that I'll be spending. It will just be a thing of the past because I've gotten what I want. But you guys should just keep remembering me in your prayers so that one day my story will change, because this my body don't see shege. The body don't see a lot. It's coming back from a lot, but we will not give up. Yes, we'll keep trying. So guys, that is it about HSG. If you find this video interesting, please subscribe to my YouTube channel. I beg, support me. Support me, because in this place I'm going to be sharing my journey as a TTC mom, also lifestyle vlog, just sharing what's everything are concerning me, concerning my lifestyle, concerning what I go through as a TTC mom, because the journey is not fun. The journey is not fun. So please subscribe to my YouTube channel, like this video, comment and share, because you don't know who needs to go for this test. Okay, you sharing the video, the person will see it, and the person will know that she's supposed to go and do this kind of thing, to know what is the problem, to know what is wrong. Okay, and I would love to see you in my another video. Bye.